Lung cancer is the second most common cancer, and it's the primary cause of cancer-related deaths in both men and women in the U.S. We asked Dr. Eric Presser of Desert Regional Medical Center in Palm Springs about the symptoms and what the optimal screening method should be to detect lung cancer.
Usually we define lung cancer as being either of the small cell category or the non-small cell category. And I could sit here and give you an hour lecture on all the different types and subtypes. But we also concentrate on the stage of lung cancer. Okay? There are 4 stages of lung cancer. And all throughout history, the problem with diagnosing lung cancer is that approximately 85% are diagnosed at a later stage. 15% are diagnosed at a stage where we can actually resect for cure. The problem with lung cancer is that by the time you have symptoms, it's usually too far gone. It means that you always hear stories that people tell about, I had a friend or I had a loved one, and all of a sudden they were coughing, and next thing you know, they were dead. And that's because by the time your body is so resilient that it actually walls off all of the trauma that the cancer is causing. So by the time you actually have symptoms, it's too late. And when I say too late, I mean your only options are usually chemotherapy with or without radiation. The reason why catching lung cancer so early is become such a focus recently is because not only do you save lives, but you catch it before you have symptoms. Lung cancer should be screened with a CAT scan, because with a CAT scan, we can find lung cancers when they are at such an early stage where if they're sent to someone like myself and I can take it out, not only do we get or obtain a definitive diagnosis, but at the same time, I can also do a proper operation and perform a proper staging of whatever we're dealing with. Smokers between the ages of 50 and 74 will benefit from a screening CAT scan of the chest. When you're talking about a piece of tissue that's abnormal anywhere, the next thought is, let's obtain a biopsy. What I offer as a minimally invasive surgeon is an option between doing nothing or doing a needle biopsy and doing a big operation. Now, if you have something that I can obtain, okay, I just take it out. And I take it out through very small incisions, which means that the stress on the body is less, the hospitalization is less, and the patient has no restrictions when they leave the hospital. When you put a needle into a lung mass, you usually get one of 3 answers. Quantity not sufficient, and you end up in my office because they want more tissue. Benign, and if you have a lesion that looks like cancer, and they put a needle into it and it came back benign, you probably don't believe it. Or the diagnosis comes back as cancer. So any 3 of those diagnoses, you end up in my office anyway. And you end up in my office after you've had a procedure which can cause bleeding, or they can collapse your lung. I mean, it's another procedure that you really should only put people through if they're non-operative candidates, in my opinion.